first guest tonight is Dr. Augustus Key, who is a radiologist with Baptist Health. And when I say radiologist, people think you read x-rays, but really it's a little bit more than that.
Right, Jeff. Radiology is a subspecialty of medicine where we do imaging acquisition and working with different physicians to acquire the images, whether that be with x-ray, CT, MRI, different modalities. Also, we do image-guided procedures as well. So we do that in conjunction with imaging.
Now you mentioned images and you mentioned several different kinds. Let's start with just a regular x-ray. We've got a chest x-ray here. What are you looking at there?
So chest x-rays is what we're going to send. Chest x-ray is mainly lungs and heart. We also have the bones and osseous structures of the chest, but it's mainly to see what's going on with the lungs and then the heart and mediastinum. Some of the abdomen's in the view, but it's to kind of see how clear the lungs are, if anything's going on with the heart, fluid, stuff like that.
So this is a pretty common test we do, but when we get into more, we get into a CAT scan. What's the difference between a CAT scan and an x-ray?
A CAT scan or CT scan is basically a ring of x-rays that a patient goes into a donut type structure and we acquire it with a ring of x-rays. So it's basically a slice by slice, kind of a bread slicing of the body in x-ray format. So it's a cross-sectional images. It's also higher detail. So this is the lung portion, this is the heart, great vessels, the aorta, such like, and this is going to give you better detail of the lung and better detail of all the structures because it's more x-rays combined into one slice.
So it's computerized, gives you more detail. You can also do that of the abdomen.
Correct. So on the left here we have an x-ray of the abdomen. It again shows soft tissue structures a little bit, also the bones, you see the spine, some of the bowel. This can be done as a preliminary test. We can move to cross-sectional or CT scan again, and this is multiple slices. We see kidneys, liver, spleen through different sections. We can also reformat. So this isn't a slice here as we're going up and down, but this is a coronal view as if we were standing the person up in front of us. It kind of matches the x-ray here, but again, more detail of all the organs and gives us a better look at what's going on.
So when would you need a CT scan versus an x-ray?
It really depends on the patient and what the process is that's going on. And a lot of people think, we should go straight to CT. If it's better, if it's more in depth and we have better detail, why not go straight to CT? Well, some processes can be seen with x-ray. It's easier, cheaper, and time of acquisition is a few seconds versus a few minutes. So it just depends on the process. And sometimes we go in a linear fashion. So sometimes we do x-ray. If we don't see what we need, we can go to CT or MRI further.
Now you mentioned the MRI. There's both of them right next to each other. What's the difference?
Again, this is acquired a little bit different. So instead of x-rays here reformatted, this is as a person is standing like I am side by side. This is with high power magnets and radio frequency. So this is not x-ray or ionizing radiation. So it's a little bit different format, but also even greater detail. So we have bones of the spine, we have the disc, which is often what we use this for. MRI is better for disc pathology, herniated disc, or acute trauma. It also evaluates the spinal cord and the spinal column better. We see it here, but again, greater detail, what we call signal to noise ratio. It's better signal and better detail for us to read for the smaller structures.
We do a lot of back pain, see a lot of back pain end up with MRI, so you're looking at like a disc hitting the cord there?
Exactly. So we're going to see the disc spaces, how they're preserved, how it affects the cord, how much it affects the cord. Again, we do these in different planes, so we do it cross-sectional, axial. This is also called a sagittal here. We do coronal. So we look at the different orientations, see how much it's affecting the cord, but also the nerves that extend from the cord, and if it's going to be associated with the pain that the referring physician's given us in the clinical history.
You also use MRI a lot for stroke and brain type stuff.
We do. So this is an MRI of the brain. This is to the mid portion of the brain. We can also do CT, which we often do to evaluate quickly on a stroke, for example, to see if there's blood, and that would preclude from certain medications that may help with the stroke at the time of an incident. MRI, again, greater detail. So if we don't see anything on the CT, or it's often negative early on with the potential stroke or something going on, seizure, we'll go to MRI of the brain, greater detail, but again, greater time to acquire. So it just depends on when it's appropriate.
And not everybody that have back pains needs an MRI. You need to start before.
Yeah, again, we often start with x-rays. Sometimes we go to CT, sometimes we go to MRI. It depends on the patient. It depends on what's going on, what they've had previous done with surgeries and stuff like that. but we can see a lot of the detail and what's going on with just an X-ray. Often we need to go to MRI, but not always.
It's great information. Thanks for coming in.